Hello class, and welcome to This Week in Health Psychology. This week we will be taking a look at stress. So the term stress means many things to many different people. A layperson may define stress in terms of pressure, tension, unpleasant external forces, or an emotional response. Psychologists have defined stress in a variety of different ways as well. Contemporary definitions of stress regard the external environmental stress as a stressor, so for example, problems at work. The response to the stressor as stress or distress, so for example, the feeling of tension. And the concept of stress as something that involves biochemical, physiological, and behavioral and psychological changes. Now, researchers have also differentiated between stress that is harmful and damaging. Sometimes we know that as distress, and stress that is positive and beneficial, eustress. In addition, researchers differentiate between acute stress, such as an exam or having to give a public talk, and chronic stress, such as job stress and poverty. The most commonly used definition of stress was developed by Lazarus and Launier back in the 1970s, who regarded stress as a transaction between people and the environment, and described stress in terms of person-environment fit. If a person is faced with a potentially difficult stressor, such as an exam or having to give a public talk, the degree of stress they experience is determined first by their appraisal of the event, is it stressful? And second by their appraisal of their own personal resources, will I be able to cope? A good person-environment fit results in no or low stress, and a poor fit results in higher stress. Now, over the past few decades, models of stress have varied in terms of their definition of stress, their differing emphasis on the physiological or the psychological factors associated with stress, and their description of the relationship between individuals and their environment. So we'll take a look at a couple of different models now. We'll start off first with Cannon's fight or flight model. One of the earliest models of stress was developed by Cannon back in the 1930s. And this was called the fight or flight model of stress, which suggested that external threats elicited the fight or flight response, involving an increased activity rate and increased arousal. Now, Cannon suggested that these physiological changes enable the individual to either escape from the source of stress or to fight. Within Cannon's model, stress was defined as a response to external stressors, which was predominantly seen as physiological. Cannon considered stress to be an adaptive response, as it enabled the individual to manage a stressful event. However, he also recognized that prolonged stress could result in medical problems. Then there's Selye's general adaptation syndrome. Now, the stress process, and this dates back to the 1950s, in this stress adaptation syndrome model, the initial stage was called the alarm stage, which described an increase in activity and occurred as soon as the person was exposed to a stressful situation. The second stage was called resistance, which involved coping and attempts to reverse the effects of the alarm stage. The third stage was called exhaustion, which was reached when the individual had been repeatedly exposed to the stressful situation and was incapable of showing further resistance. Now, in an attempt to depart from both Selye's and Cannon's models of stress, which emphasized physiological changes, the life events theory was developed to examine stress and stress-related changes as a response to life experiences. Now, Holmes and Ray developed the Schedule of Recent Experiences, the SRE, which provided respondents with an extensive list of possible life changes or life events. These ranged in supposed objective severity, from events such as death of a spouse, death of a close family member, and going to jail, to more moderate events such as son or daughter leaving home and pregnancy, to minor events such as vacations, change in eating habits, change in sleeping habits, and change in number of family get-togethers. Originally, this schedule of recent experiences was scored by simply counting the number of actual recent experiences. For example, someone who had experienced both the death of a spouse and the death of a close family member would receive the same score as someone who had recently had 2 holidays. And it was assumed that this score reflected an indication of their level of stress. Now, early research using this schedule of recent experiences in this way showed some links between individuals' scheduled recent event score and their health status. However, this obviously crude method of measurement was later replaced by a variety of others, including a weighting system, whereby each potential life event was weighted by a panel, creating a degree of differentiation between the different life experiences. Now, let's look at the role of psychological factors in stress. So, for Cannon's and Selye's early models of stress conceptualized stress as an autonomic response to an external stressor. This perspective is also reflected in versions of life events theory, which suggests that individuals respond to life experiences with a stress response that is therefore related to their health status. However, there are some criticisms of the life events theory, as I've already mentioned, that suggest a different approach to stress, an approach that includes an individual who no longer simply passively responds to stressors, but actively interacts with them. And this approach to stress provides a role for an individual's psychological state and is epitomized by Lazarus's transactional model of stress and his theory of appraisal. So let's take a look at the transactional model of stress and the role of appraisal. Back in the 1970s, Lazarus's work on stress introduced psychology to understanding the stress response. This role for psychology took the form of his concept of appraisal. Lazarus argued that stress involved a transaction between the individual and their external world, and that a stress response was elicited if the individual appraised a potential stressful event as actually being stressful. Lazarus's model of appraisal therefore described individuals as psychological beings who appraised the outside world, not simply passively, but responding to it. Lazarus defined 2 forms of appraisal: primary and secondary. Now, according to Lazarus, the individual initially appraises the event itself, defined as primary appraisal. And there are 4 possible ways that the event can be appraised, according to Lazarus. First, as irrelevant, or second, benign and positive, or third, harmful and a threat, or fourth, harmful and a challenge. Lazarus then described secondary appraisal, which involves the individual evaluating the pros and cons of their different coping strategies. Therefore, primary appraisal involves an appraisal of the outside world, and secondary appraisal involves an appraisal of the individual themselves. Now, the form of the primary and secondary appraisals determines whether the individual shows a stress response or not. Now, according to this model, the stress response can take different forms. First off, direct action, or secondly, seeking information, or thirdly, doing nothing, or fourthly, developing a means of coping with the stress in terms of relaxation or defense mechanisms. Now, Lazarus' model of appraisal and transaction between the environment and the individual indicated a novel way of looking at the stress response, where the individual is no longer passively responding to their external world, but are interacting with it. Now, there have been several studies that have examined the effect of appraisal on stress and have evaluated the role of the psychological state of the individual on their stress response. Back in the 1960s, a study by Spiesman and his team suggested that the subjects were shown a film depicting an initiation ceremony involving unpleasant genital surgery. The film was shown with 3 different soundtracks. In the condition, the trauma condition, there was the soundtrack emphasizing the pain and mutilation. In condition 2, the denial condition, the soundtrack showed the participants as being willing and happy, and in condition 3, the intellectualized condition, the soundtrack gave an anthropological interpretation of the ceremony. The study therefore manipulated the subject's appraisal of the situation and evaluated the effect of the type of appraisal on their stress response. The results showed that subjects reported that the trauma condition was most stressful. This suggests that it is not the events themselves that elicit stress, but the individual's interpretation or appraisal of those events. Similarly, Mason, 10 years later in the 1970s, argued that the stress response needed a degree of awareness of the stressful situation, and reported that dying patients who were unconscious showed less signs of physiological stress than those who were conscious. And he suggested that the conscious patients were able to appraise their situation, whereas the unconscious ones were not. Seems obvious, but it gives us some insight there. And these studies therefore suggest that appraisal is related to the stress response. However, in contrast to these studies, some research indicates that appraisal may not always be necessary. For example, Repetti in the 1990s assessed the objective stressors such as weather conditions or congestion, and subjective stressors such as perceived stress experienced by air traffic controllers, and reported that both objective and subjective stressors independently predicted both minor illnesses and psychological distress. This could indicate that either appraisal is not always necessary, or that at times individuals do not acknowledge that their level of subjective stress. Now, in line with this possibility, some researchers have identified repressors as a group of individuals who use selective inattention and forgetting to avoid stressful information. Such people show incongruence between their physiological state and their level of reported anxiety. For example, when confronted with a stressor, they say, "I'm fine," but their body is showing arousal. And this suggests that although appraisal may be central to the stress response, there may be some people in some situations who simply deny or repress their emotional response to a stressor. Now, what events are appraised as stressful? So, Lazarus has argued that an event needs to be appraised as stressful before it can elicit a stress response. It could be concluded by this that the nature of the event itself is irrelevant. It is all down to the individual's own perception. However, research shows that some types of events are more likely to result in a stress response than others. So there are salient events, and people often function in many different domains, such as work, family, and friends. For one person, work might be more salient, while for another, their family life might be more important. Some researchers have argued that stressors in salient domains of life are more stressful than those in more peripheral domains. Okay, then there are overload. Now, multitasking seems to result in more stress than the chance to focus on fewer tasks at any one time. Therefore, a single stressor which adds to a background of other stressors will be appraised as more stressful than when the same stressor occurs in isolation, commonly known as the straw that broke the camel's back. And we've all experienced that, particularly in our college studies. Ambiguous events. If an event is clearly defined, then the person can efficiently develop a coping strategy. If, however, the event is ambiguous and unclear, then the person first has to spend time and energy considering what coping strategy is best. And this is reflected in the work stress literature, which illustrates that poor job control and role ambiguity in the workplace often result in a stress response. And then finally, uncontrollable events. If a stressor can be predicted and controlled, then it is usually appraised as less stressful than a more random, uncontrolled event. For example, experimental studies show that unpredictable loud bursts of noise are more stressful than predictable ones. Then we need to consider the ideas of self-control and stress. So recent theories of stress have emphasized forms of self-control as important in understanding stress. So we can think in terms of theories of self-efficacy, hardiness, and feelings of mastery. So when we look at self-efficacy, Lazarus and Folkman suggested that self-efficacy was a powerful factor for mediating the stress response. Self-efficacy here refers to an individual's feeling of confidence that they can perform a desired task. They think they can do it. And research indicates that self-efficacy may have a role in mediating stress-induced immunosuppression and physiological changes such as blood pressure, heart rate, and stress hormones. For example, the belief, "I am confident that I can succeed in this exam," may result in physiological changes that reduce the stress response. Therefore, a belief in the ability to control one's behavior or be adequate to the response of the stressor may relate to whether or not a potentially stressful event results in a stress response. Then there's hardiness. And this shift towards emphasizing self-control is also illustrated by Kobasa's concept of hardiness. Now, hardiness was described as reflecting, first off, the person's feeling of control, secondly, a desire to accept challenges, and thirdly, commitment. And it's been argued that the degree of hardiness influences an individual's appraisal of potential stressors and the resulting stress response. Accordingly, a feeling of being in control may contribute to the process of primary appraisal. And then finally, mastery. Some researchers have defined the term feelings of mastery, which reflect an individual's control over their stress response. And here they argue that the degree of mastery may be related to the stress response. In summary, then, most current stress, as researchers consider stress, as the result of person-environment fit, and emphasize the role of primary appraisal in the event. Is the event stressful, for example? And secondary appraisal, can I cope? So psychological factors are seen as central components to the stress response. However, they are always regarded as co-occurring with the physiological changes. So we always need to keep that in mind. Now, what about stress and changes in physiology? Well, the physiological consequences of stress have been studied extensively, mostly in the laboratory using the acute stress paradigm, which involves bringing individuals into a controlled environment, putting them in a stressful situation such as counting backwards, completing an intellectual task, or giving an unprepared speech, and then recording any changes. The research has highlighted two main groups of physiological changes. First off, the sympathetic activation. When an individual has been appraised as stressful, when an event has been appraised as stressful, it triggers responses in the sympathetic nervous system. And this results in the production of catecholamines, things like adrenaline and noradrenaline, also known as norepinephrine and epinephrine, which cause changes in factors such as blood pressure, heart rate, sweating, and pupil dilation. And all of these are subjectively experienced as feelings of arousal. And this process is similar to the fight and flight response described by Cannon. Now, catecholamines have also have an effect on a range of the body's tissues and can lead to changes in immune function. And then there is something known as the hypothalamic pituitary adrenocortical, the HPA activation system. So in addition to the sympathetic activation, stress also triggers changes in the HPA system. And this results in the production of increased levels of corticosteroids. The most important which is cortisol, which results in more diffuse changes such as the management of carbohydrates stored and inflammation of tissues. And these changes constitute the background effect of stress and cannot be detected by the individual. They are similar to the alarm, resistance, and exhaustion stages of stress described by Selye. In addition, raised levels of brain opiates, beta endorphins, and other hormones have been found to follow stress, which are involved in immune-related problems. So the whole idea of stress reactivity is very much a physiological thing. The changes in physiology are really known as stress reactivity and vary enormously between people. For example, some individuals respond to stressful events with high levels of sweating, raised blood pressure and heart rate, while others show only minimal response. This, in part, is due to whether stressors are appraised as stressful, the primary appraisal, and how the individual appraises their own coping resources, the secondary appraisal. However, research also has shown that some people are simply more reactive to stress than others, regardless of appraisal. Two people may show similar psychological reactions to stress, but different physiological reactions. In particular, there's some evidence from gender differences in stress reactivity, with men responding more strenuously to stressors than women, and women showing smaller increases in blood pressure during stressful tasks than men. And this indicates that gender may determine the stress response to a stressful event, and consequently the effect of this response on the health or health status of the individual. Stress reactivity, therefore, is thought to be dispositional and appears to be largely genetic, or as a result of prenatal or childhood experiences. And there is a lot of evidence to support gene activation and how that is affected by early stressful childhood experiences. So overall, stress is an interaction between psychological and physiological responses to the environment. So stress is generally considered to illustrate the interaction between the psychological and physiological factors. The psychological appraisal to a stressor or of a stressor is central to the stress response. And without appraisal, physiological changes are absent or minimal. Therefore, the degree of appraisal also influences the extent of the physiological response. However, there is little research illustrating a link between how stressed people say they are feeling, perceived stress, and how their body is reacting, their physiological stress. It's likely that the mind-body interactions that we see with stress are dynamic and ongoing. Therefore, rather than appraisal causing a change in physiology which constitutes the response, appraisal probably triggers a change in physiology which is then detected and appraised, causing a further response, and so on. In addition, psychological factors such as control, personality, coping, and social support will impact upon this ongoing process. Indeed, there are a multitude of studies that have been done on the role of cortisol in the impact upon gene expression, upon neuron development or propagation, and all of that can play a role in breaking down a person mentally, biochemically, and so on. So that's a quick introduction to what stress is and how we can consider it. I hope you enjoyed this lecture. Next week we will look at stress as it relates to the development of illness a little more clearly. I hope you enjoy. You take care. Bye-bye.